Hello, I'm Dr. Charles Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here to provide you with this COVID-19 update for Simcoe Muskoka. When I last reported, I would like to acknowledge that it appeared like my puppy was not on the left-hand side, that it was on the right. And I'd like to say that that was because with our technology, we had my image laterally inverted like a mirror image, so that right was left, left was right. I had some people remind me that it's necessary and appropriate for it to be on the left over the heart. And thus we fixed that technical issue, and it should be where it belongs. I'd like to apologize for anyone that took any offense. Certainly wasn't intended. So today we have a total of 1,560 cases. This is up by 110 cases since I last reported a week ago. And this is to be compared with the week before, which was higher at 154 cases. So some good news, some reduction in our case count or incidence compared with the week before. One always needs to be cautious about the interpretation of this. It's possible that it's the beginning of a downward trend or leveling out, but we, with a single week of data, cannot be certain of that. So we shall have to see how things go, and certainly we need to be vigilant all the way through, all of us. It's what we do collectively together that flattens the curve and brings us under control. All the individual efforts that we all take in physically distancing, keeping to your household for close contact, hand washing, face coverage in indoor public spaces and workspaces, self-monitoring and self-isolation, and testing if you develop symptoms. We've had so far this week 67 cases. So over the weekend, 50 cases and 17 as of yesterday. If we look at the last 17, 16 of them are sporadic. One of them is from a workplace. 9 are males, 8 are females. Their ages range from under 10 to in their 50s. All of them are in Simcoe County. One of them is community acquired. 4 are close contacts of another case. 11 are under investigation, and 1 is part of a workplace outbreak. 16 are in self-isolation, and 1 is recovering in a facility. So we have at this point in time a total of 143 active cases, which is down from 207 last week. And we've had a total of 1,360 cases that have recovered. So that's up from last week of 1,192. We have 8 cases in hospital, which is up from 6 a week ago. Their ages range from the 40s to the 80s. 7 of them are from Simcoe County. 1 of them is from Muskoka. One of these individuals is in the intensive care unit. So 3 of them are in RVH. 1 of them is in Southlake. 1 of them is in 2 of them are in Georgian Bay General Hospital. 1 is in Muskoka, Algonquin, and 1 is in Mackenzie Health in Richmond Hill. We've had no additional deaths over the past week, so that means that our total death count since the beginning of the pandemic is 50. Currently, we have 12 active outbreaks, down from 13 a week ago. So 5 of them are in institutions. 3 of the 5 are new in the past week. IOOF, Seniors Residence in Barrie, Allendale Station Retirement in Barrie, and Sunset Manor, Long-Term Care Facility in Collingwood. I will be going into more detail about the outbreaks a little later. We've had 2 of our outbreaks declared over. So Riverwood Senior Living Retirement Home in Alliston and Granite Ridge Retirement Home in Gravenhurst have been declared over. We have one outbreak in a congregate setting. So we have had one new outbreak in a group home, which is in Simcoe County, and then one outbreak in a congregate setting, a group home, declared over in Simcoe County. We have 2 workplaces that are an outbreak. This is down from 4 a week ago, so 2 are ongoing and 2 have been declared over. So the 2 that are ongoing are both in manufacturing in Simcoe County, and the 2 that are declared over are as follows: 1 manufacturing in Simcoe County and 1 an agricultural setting in Simcoe County. We have 3 educational settings that are an outbreak. 2 are schools and 1 is a licensed childcare center. So 1 Bradford High School, 1 Hillcrest Public School, and 1 a licensed childcare center in Simcoe County. And we have 1 what we call a community setting outbreak. That was a hair salon that I've spoken to a week ago with no change in the number of people involved. So 2 customers and 3 staff who are cases, and 95 high-risk contacts in self-isolation. So we continue to see clusters happening in household settings, whether they would be family households, multi-generational family households, or young adults who are not family members living together as students or working, or both. Most of our cases overall, new cases, have been in the southern municipalities in Simcoe County and in Barrie. So that's been a pattern that has continued all the way through the pandemic. Far fewer cases in northern Simcoe and in Muskoka. There's certainly a connection with these cases and travel to the Greater Toronto area for work purposes or socializing purposes, becoming cases and then affecting the rest of the household, and a number of other people in the household becoming cases. And also our largest institutional outbreak is in southern Simcoe as well, Simcoe Manor and New Tecumseth. In terms of schools, we've since September the 10th have investigated 62 incidences where individuals who've been cases have been in the school environment with an exposure to the school, and this has resulted in 2 outbreaks in schools to date: Bradford District Secondary School and Hillcrest Elementary School. In terms of our dashboard, which is up on our website, we remain in yellow alert. And this is unchanged from a week ago. If you look at it, it's got 4 sections, and one of the 4 is red with regards to viral spread and containment. This is because of our high case count, although that case count did come down over the last week. And we did have an increase in hospitalization, up to 8 from 6 in the past week. And we continue with a high number of outbreaks, although slightly down from a week ago. Our laboratory testing remains in yellow, and this is because the turnaround time for tests is still not on target for 1 to 2 days. It's a significant number of tests that are longer than that duration. Our healthcare system remains in yellow because of high hospital occupancy and ICU occupancy, even though this really is unrelated to COVID transmission, given that the total number of cases in the hospital here is only 8. It's really just due to care for other things unrelated. The public health system capacity is in yellow because we still remain challenged with new high-risk contacts being contacted within a day, although improved. So our target is more than 90%. We're actually reaching them within 85%. are being reached within a day, and that's up from 82.7% a week ago. So on the whole, some improvement, but it's not actually resulted in a change of color on our dashboard. And I would say that the province now has a dashboard too, which I cited a week ago, and I'll talk about a bit in a moment. But we decided to maintain our own dashboard as well. We put a lot of work into it. It's quite rigorous with regards to our own local epidemiology, whereas where the province places us on their dashboard is driven not just by data and epidemiology, but also by judgment on their part and discussion with local individuals, including myself as medical officer of health. So we'll be maintaining our own dashboard. In terms of the trajectory of the pandemic here, we have some improvement. So because our case count over the last week improved, so too has the incidence rate of COVID-19 over the week, which last week was 18.8 cases per 100,000 population versus the week before at 24.1. Because of this, our daily growth rate as a percentage came down to 1.1%, down from the previous 1.5%. By comparison, Ontario is 1.3%, which is up slightly from what they were a week ago at 1.2%. Our reproductive number is unchanged at 1.1, so anything above 1 means either stable or growing. And the province is also unchanged at 1.1. Our doubling time has increased, which is a good thing. You want the longer the doubling time, the better. The longer it takes for the rate of growth to result in twice as many cases as we have now, you want that to be longer and longer. And so that has increased to 70.8 days, up from what it was a week ago at 48 days. And just so, by way of calculation, with this doubling rate, if it were to keep up at a steady pace, we'd end up with about 3,000 cases by January the 17th, 2021. In terms of our outbreaks, to go into some of the details, the outbreak at Simcoe Manor continues. We've had, unfortunately, some increase in our cases. So the number of staff cases over the past week increased to 32 from 28. And by the way, 9 of those cases are out of jurisdiction, and so they don't show up in our statistics. They live out of our area. And we have 32 cases among residents, up from, 33 cases in our residents, up from 32 a week ago. So certainly it's been very much a team effort between Simcoe County as the operator for that facility, Royal Victoria Hospital as the appointed manager for the response, the provision of leadership, the provision of infection control, practitioners of infectious disease specialists, overall leadership, the county providing more in the way of human resources, more in the way of sanitation requirements. The health unit, Simcoe Muskoka District Health Unit, having overall accountability and authority for bringing the outbreak to a close and continuing to monitor the situation, work closely with the situation, assess compliance with requirements for infection control. I'm meeting on a very regular basis with senior management involved in those facilities, those agencies, to carry this through to the very end. We've done repeated testing of staff and residents and maintain the infection control practices that are needed in order to bring this to an end. Unfortunately, we have seen some additional transmission, and so it behooves us to continue with our efforts to bring it to a close. Waterford Retirement Residents in Barrie had an outbreak declared on November the 2nd. They have one positive resident as a case and no staff cases. So the facility is on droplet precautions and contact precautions, and testing is being done for the staff and for residents that have been involved as well, as required by the provincial protocol. And we have back negative swabs for the majority of staff, with some of the swabs still pending, and same with the residents. The majority have been, almost all have been tested, and the majority have come back negative, with some that are still pending. IOOF, seniors, residents in Barrie had an outbreak declared on November the 4th. We have one positive staff member and no resident cases. Testing has been done for the residents, and we're awaiting results, and also for staff. Allendale Station Retirement Home in Barrie had an outbreak declared on November the 5th. They continue with 3 resident cases that are positive, and 2 staff cases as well, all in isolation. We've tested the staff as well as the residents, and we have some but not all of the results back. Sunset Manor long-term care facility in Collingwood was declared as an outbreak on November the 8th. We have 1 positive staff case and no positive residents to date. Testing has been completed for the staff, with the majority of results still pending, and same with the residents. In terms of our educational facility outbreaks, Bradford Secondary School, Bradford District's High School, I should say, we now have 3 positive students, and all other individuals who are contacts are in isolation. We have Hillcrest Public School declared as an outbreak on November the 2nd, with 2 positive students as cases, and the contacts involved with the class as well as 2 buses have been identified and put into isolation. And we have an outbreak at a child care center in Barrie declared on November the 2nd, with 3 positive cases, 2 staff and 1 of the residents, with all other individuals having been identified and put into self-isolation at home. We have a group home that's been declared over as an outbreak, as I'd identified before. So that was an outbreak that was declared on November the 6th, with 1 staff member who was declared as a case, and none of the residents were declared as cases. We have a second one that was declared, a long-term care facility declared in Simcoe County. Sorry, a group home declared as an outbreak in Simcoe County. And that involves actually 1 staff member who lives out of district, and we have no additional cases associated with that situation. Currently, we have, as I mentioned in my last report, a community setting outbreak, personal services setting, which was a hair salon, and there are no additional cases associated with that, so that situation continues. 2 customers and 3 staff members, with other staff testing negative. In terms of workplace outbreaks, we have 2 workplace outbreaks that remain, down from 4. One of them is a manufacturing facility in Barrie, declared on October the 28th, with 3 staff as cases and other employees testing negative. And another is a manufacturing facility in Barrie, declared on October the 31st. That facility I reported on a week ago. They're up to 13 staff cases, and that's up from what they had a week ago with 4 cases. So definitely a significant increase in the number of cases associated with that. Otherwise, negative test results in the other employees of that facility. So moving to my media messages. First, I'd like to say that tomorrow is Remembrance Day, and it is certainly important that we all commemorate our fallen heroes and their sacrifice, their major contributions to our society. But this is the year of the pandemic, and I would urge people to do so remotely, to take in televised means or through social media, through remote methods of attendance. If you do attend in person, there are restrictions on gatherings and the size of gatherings outdoors, and also the requirement for people to be physically distancing 2 meters, and use of mask if in doubt, if you're unable to distance. So by all means, we need to commemorate this event as we always do, but to do so safely this year. Also to remind you that the health unit is one of those agencies that is closed on Remembrance Day. And so although we will continue with our case and contact management and emergency response, as we always do, as we do on weekends, we otherwise will not be posting our case count on the day. It'll be on the day that follows. And our Health Connection line will also be closed tomorrow. The province has, as I'd mentioned, their own framework now for alert levels and requirements that go with that. And they declared that Simcoe, Muskoka would be on the yellow alert level. This was communicated late in the week, and over the weekend they made available regulations to go with this framework, and that stipulated where we lie. And so this has certain requirements for us for protection that include a reduction in the number of people that can sit at a table while dining in a restaurant or a bar, down to 6. I would also urge as a recommendation that you stick to household members, or if you live alone, the adopted household that you would choose when you go dining. This is in keeping with my general recommendation, the province's general recommendation, that you stick to household members for close contact. And when you're sitting at a table in a restaurant, you indeed are closer than 2 meters without a mask while eating. So it's much safer if you stick to your household when you do that. But the yellow protect level also places a restriction on the number of people that can be at a recreational class, so no more than 10 people, less if space doesn't allow for physical distancing within that setting, and also requires 3 meters distance instead of 2 meters distance, in recognition of the additional exertion that people undergo when they're doing physical activity, and how that can lead to a greater spread of droplets from breathing that can transmit. With over 70 cases from such a class. So that would be the reason why they now wish to restrict the the number of people involved and to spread people out further. Other than that, there are requirements that speak to hours of the provision of alcohol in various settings, and a requirement to reduce levels of music so that people don't have to shout to be heard, because shouting too has been shown to augment droplet spread and transmission. So that's now in place, and we're working through that as a health unit with regards to the details of the regulations and exactly what they mean. This is something I'll be communicating with municipal CAOs about on Thursday, verbally in a meeting that I have with them each week. And we have received a lot of calls from businesses to clarify about this. So we will be proactively communicating about requirements when we gain a better understanding of them ourselves. And we've created a lot of communication tools about such requirements, and we'll have to continue to do so as things like this change. One of the other things I would note is with personal service settings, there's a requirement for all the patrons to have their names documented. This is certainly important for follow-up. It was very important with regards to the one outbreak that we've had with a hair salon, where we, because they had good records, we were able to contact everybody directly, which is much more effective than if we didn't have that list. So that's certainly a good requirement. You know, I've spoken to the fact that our cases here have been driven by work environments and by household clusters and by social contacts. And so there's some key lessons when we look at our data to be learned about work environments. And this is a message to those who work and to employers. So they are as follows. Where at all possible, people should be working online remotely from a distance. And when not possible, they should be exercising all of the other infection prevention and control practices, and where appropriate, personal protective equipment. We're finding that lunchrooms can be a problem. So people will be distancing appropriately on the job, and they'll be wearing personal protective equipment when required, or a mask, face covering, and then they can let down their guard when they go to the lunchroom together and transmit that way. So it's really key that employers and employees think through everything about the work environment, including what lunch looks like and having it staggered in hours for people so they're not there together, and that they're physically distancing, and flow, you know, one-way flow so that people don't have to squeeze by each other. Change rooms, the same thing. They have to think through the timing, the spacing of physical distancing, the flow of people, use of masks. And one-way flow in the work environment where at all possible, using arrows and such, thinking through how can you avoid people squeezing by each other in hallways. There's been instances where cleansing has fallen short, so you need protocols and practices in place so that you're doing appropriate cleansing and hand hygiene, hand washing, having available hand washing stations or hand sanitizer available, and reinforcing and requiring its use. A lack of screening of employees. You should have a systematic way of screening employees for symptoms and systematically excluding them if they develop symptoms. So that needs to happen on an ongoing basis. Use of face coverings and masks, particularly where you cannot physically distance, needs to be systematically enforced. And care with regards to travel associated with work. So people in cars together, whether it's coming to work or as part of your work, you need to be thinking in terms of face coverings, distancing if you can, with somebody in the back seat, another in the front seat, driving, and ventilation, window partially open to reduce the risk of transmission in a car. So really key things. I would also say for school environments, parents need to be screening their children before sending them to school. those exposures that we've been having are a large number. They have a big impact on many people who end up having to go into isolation quarantine, and it resulted in our 2 outbreaks. Another point, the Chief Public Health Officer of Canada from Health Canada in the past week issued a revised recommendation about face coverings and masks, now recommending that masks should be triple layered, have 3 layers to them. So this is an augmentation meant to be more protective. It's meant to be more effective at catching droplets and preventing spread with droplets. The point of a cloth mask is much more about source protection. The person who wears the mask protects other people more so than themselves just by design. And so this is meant to be a further level of protection. So I would say that this is a recommendation. It's not a requirement under legislation, or it's not a requirement under my letter of direction or the province's regulations. Those require a face covering of some kind, isn't specified. So this would be a best practice recommendation. So some questions that we received from the public through our Health Connection line are as follows. What do you do if you have been notified from a case that you are a high-risk contact? So what I would recommend is there may be instances where that's how you find out. As I'd mentioned before, we've been limited to some degree in our ability to reach all contacts because of the caseload. We've had some improvement on that. We've been able to make headway because of better use of the services provided by Public Health Ontario and Statistics Canada to do contact tracing for us. But there are still instances where we may be asking a case to follow up with the contacts. We're still taking information about those contacts, but we may ask the case to follow up and advise them. So if you fall into that camp and you've been advised by a case that you're a high-risk contact, you need to self-isolate for the incubation period of 14 days after the last point that you had contact with that case. And we would recommend you get tested as well. Ideally 5 to 7 days after the point that you had last had contact with the case. That's when the test is going to be most sensitive. Or if you develop symptoms, go and get tested right away. But you need to be isolating and you need to be testing. And by all means, you can contact us for further information as needed or visit our website. With cold and flu season here and symptoms that may be similar to COVID, should I get tested? So if you develop any of the symptoms of COVID-19 and the province has a tool that you can use, and you can access it via our website, to screen yourself to decide what to do, I recommend that you use that tool, but it's going to err on the side of caution and inclusion, and probably identify that you need to isolate and seek assessment and testing. If under those situations you have symptoms, you test and you're negative, we would accept that as this is not COVID because you have symptoms, yet your test is negative, and therefore you would be able to come out of isolation if you're not feverish and if you are improving. It's probably better yet if you've completely resolved, because you have something, and you can certainly transmit that something, even if it isn't COVID-19. So who will phone me to do contact tracing if I'm identified as a close contact by someone who is a case? So as I indicated to you before, it's possible that that's how you are notified by your case. But in most instances, we're still able to do the contact either ourselves as an agency or Public Health Ontario doing it. If you get a call from us, you will probably see on your monitor your call display that it is a health unit that is calling. But it could also be from Public Health Ontario, and in that instance, it does not indicate an agency. So don't be surprised if that's the case, if you get a call and that's what's indicated. So some questions from the media. Where is contact contact tracing at these days at the health unit? Did you get extra resources to get it back up to 100%, or has it dropped quite a bit? So it's actually improved a bit, which is a good thing. We've been able to reach all confirmed cases within a day. Or not all, but 93.8% of the cases were able to reach within a day, which meets the provincial standard of more than 90%. The high-risk contacts, 85.1%, which is slightly up from what it had been a week ago. So we have some slight improvement. That's in part because we've been able to use Public Health Ontario and Statistics Canada to do some of that work for us. We've also been successful in recruiting our 26 nurses for the school health response, and some of those nurses have been put to the task of case and contact management affiliated with the schools and the school contacts and school cases. So that helps, and also having a reduction in cases over the last week certainly helps us as well. We still have a large number of contacts with our cases, but that week of reduction is helpful to us. And as I said, I hope that continues, but we cannot know that yet at this time. We still need to be careful about that. Okay, at this point I'd be happy to take any questions or comments.
Dr. Gardner, James Bowler, would you like to go ahead, please?
Thank you very much. So, Dr. Gardner, just looking at these numbers in Ontario over the last 3 days, it seems like we're continuing now to move up again. But the Premier has said that, he's pretty much not willing to look at a lockdown scenario again because his medical officials are saying that it's not something that needs to happen. However, in Alberta, their physicians are kind of calling for a 2-week shutdown to curb their wave. So is that something that you would suggest that might be a benefit to Ontario to save the economy moving forward?
So, the mandate of public health is health. It's the health of the population. And right now we are very much focused on COVID-19 as the pandemic and how it's impacting on us in the province and specifically locally as medical officers of health. We have this new framework from the province. It has an alert system. I think it's a very good thing to have a document out of that nature so that we know the approach being taken, so that there can be feedback on it to the province about its adequacy. For example, there can be discussion around what needs to be done locally based on it. It is meant to be implemented locally, and the province has identified at this point in time where each of the municipalities, each of the health units lie on this spectrum of response. I've noted already that the health units at the very top of the curve, those that are in red alert, the red control phase, or above it, more than 100 cases per 100,000 population per week, such as Peel. Also thinking of Toronto with a very high case count, that they are looking at their own additional control measures they put in place. So the medical officer of health in Peel issued a letter of instruction requiring more control measures for Peel. And Toronto, I believe, has an extension of itself being in modified stage 2 with the continuation of closure of indoor dining for the moment. I believe that when you get to high levels, we need more controls, and that kind of action, if the framework isn't changed, will end up being required of local public health, local medical officers of health to look at what additional controls are needed. Certainly, we don't want at all to have to go to a complete lockdown. The rates of transmission in some parts of the world are much higher than the 100 cases per 100,000 population per week, 5 times or more higher, the United States, the United Kingdom, for example. And we certainly don't want to end up with an exponential growth pattern where you end up moving towards that. So I think we're going to have to be very much on our guard as you get to higher levels as to what else is needed in the way of control measures. It puts a lot of onus on local public health to look at that and make those kind of decisions. They're tough calls to make. I would say at the lower levels within the spectrum, it's actually been helpful. For us at Simcoe, Muskoka, by being put into the yellow, we have those additional controls with regards to numbers of persons seated together in restaurants and bars, and the number of people that would be in recreational classes and the spacing of those people. So at our level, I find it helpful, but I think we're going to have to be very much on our guard as you move up that spectrum. I would also say that locally, I chose a week ago to issue an order to further protect our long-term care facilities by restricting visitation to essential visitors only. Households, families being able to identify 2 individuals only who would be considered essential. So the onus, I would say, as you go up within that scale, ends up to a large degree falling on the medical officer of health to look at additional measures.
And just as a follow-up, and I'm going to contradict myself, but I want to look at both sides of the coin here. You know, we've talked about the Simcoe Muskoka region being in a yellow area, but I've asked you before, is there potential that you can look at partitioning the areas? Because again, Muskoka and Simcoe are miles apart in terms of how these areas are affected by COVID right now. And, you know, yellow is not as punishing, but if you go to red or even higher, it is punishing businesses in Muskoka, you know, like an area where we're not having a high spike.
Yeah. So I acknowledge there's a big difference in the incidence within our district. In Muskoka, it can be very low, 3 cases per 100,000 population per week. In South Simcoe, it can be 50 or more cases per 100,000 population per week. Overall, we're now just below 20 cases per 100,000 population per week. We've declined from last week, which is a good thing, but we can't be certain of its trajectory. I know that the province, they've made their decision. They're going with entire districts, entire health units in terms of the allocation. If they change their mind about its application in the future, that would be their decision to make. We, as medical officers of health, cannot relax the controls. We can further augment them with orders, but we can't relax them. So where I might have the potential to apply additional measures, and I could choose to do so geographically specifically, focusing on areas within Simcoe, Muskoka that are more impacted. I wouldn't be able to relax them, the ones that are in place for yellow, say, within Muskoka.
Thank you.
You're welcome.
Thank you, James. Sarah Law from Muskoka region. Go ahead, please. Good afternoon, Dr. Gardner.
Good afternoon.
Do you fear that people who live in more restricted zones will travel to the less restricted zones like Simcoe, Muskoka, and then potentially further the spread of the virus?
To some degree, we've already seen that. So when Peel and York were in modified stage 2 with the closure of restaurants and bars and some recreational facilities, I know that our municipalities just to the north of those boundaries, we're seeing an uptake of use of the facilities there, and we're looking at putting in place restrictions to prevent that. So we know that happens, and the potential for it exists, I would say. I've recommended to the province that they emphasize at least a recommendation that people not do that people not travel for that purpose, that they stick to their own community, and unless they have a good reason otherwise to leave their community. And I support my municipalities if they decide to put in place restrictions that are related to that.
Thank you. And my follow-up is, what information do you think the general public should keep in mind with news of the potential vaccine from Pfizer?
We're all watching that very closely, the development of vaccine. I think it's it's a great hope for us to end this pandemic with population vaccination against COVID-19, to have an effective vaccine and be able to do that. Some have cautioned that we need to temper our hope, to wait and see how things play out. So the Chief Public Health Officer of Canada has indicated this may not be a silver bullet. It would depend on how effective the vaccine is. It would, regardless, take time to get enough vaccine to cover the entire population, or enough of the population to break transmission for this virus. You'd have to see what the uptake would be in the population, whether you'd get enough people willing to participate, though I believe we would actually have a very high uptake, voluntary uptake. But I'm very hopeful, and I certainly was happy to see the reporting on it. It was not a scientific study, it was a news release, so we haven't seen the scientific data. I haven't been able to evaluate it from that point of view. And we know that it's just preliminary data. It's not by any means the totality of their trial.
Thank you.
You're welcome.
Thank you, Sarah. Chris Simon from the Barrie Advance. Are you on the line today?
I am. Thank you very much. Dr. Gardner, I'm hoping that maybe you can tell me whether or not there have been an awful lot of businesses or community organizations who have reached out over the province's color coding system. We heard from a local curling club who actually thought that they had to close as a result of what they saw with Simcoe, Muskoka being in yellow. Just wondering whether or not you've heard an awful lot from businesses who may need some help.
Mm-hmm. So the regulations came out over the weekend, and sure enough, yesterday we had a very large number of phone calls from businesses and associations. As I said, we're working through, the fine detail of the regulations ourselves to make sure we understand it properly. We're going to have to do a lot of communicating. People are reaching to us, and we'll have to reach out broadly to them as well when we get the data, the message is clear.
Just to follow up, you had some great tips about staying safe kind of in workplace settings earlier in your press conference. Just wondering whether that's based on any particular incidents, whether the health unit has been made aware of businesses who maybe don't have proper PPE or sanitization on site, or whether people are knowingly going to work in school sick.
It's based on our experience with our outbreaks, whether it would be, the school situations, the school exposures, the workplace manufacturing locations, congregate settings, etc. It's based on our experience, what we've seen to date, the kind of ways in which transmission happens in these places, or it's also based on exposures where we didn't detect an outbreak, but we sure saw the potential for it.
Thank you.
You're welcome.
Thank you, Chris. Erica Ankle from Barrie today. Go ahead, please.
Thank you. Hi, Dr. Gardner.
Hello.
My question is also related to the provincial framework. I'm understanding that you maybe don't have all the details on how it works, but my question was about the recreational facilities.
Mm-hmm.
So for an arena, for example, would they be required to have 10 people on the ice at a time? Would a pool have to go down to having 10 people in the pool at a time? How's that going to work?
It's not clear to me yet. I do need to get a better sense of it from our read of the regulation, from a discussion with the staff. One thing for sure, it would apply to classes like yoga classes, spin classes, that type of thing, because that's where we've seen transmission. But those other venues, it's not yet clear to me.
Is that just like a lack of clarity from the province then? Have they not put out all these details yet, or?
Possibly. I do need to wrap my head around it myself and get my staff's consensus on it and their consultation up to the province and with their colleagues. So I'd rather have that clarity before being able to give a good answer to you.
Are you concerned at all that these regulations went into place on Saturday, but we're still not very clear on what exactly we're supposed to be changing?
Well, that's 3 days. And part of that was on a weekend, right? So normally when you have regulatory changes these are not normal times, right? So you have short timelines, but normally you have a lot of time with a new regulation before it comes into effect, rather than it comes out but it's already happening, right? So it's been part of the challenge, the pattern that we've seen all the way through with the pandemic, I think in part and parcel related to a rapidly moving pandemic.
Thank you.
You're welcome.
Thank you, Erica. Brandon Piper from Moose FM. Go ahead, please.
Hey there, Dr. Gardner. How are you?
I'm doing okay. How are you?
Not too bad. It's still obviously early in the month to really sort of indicate, but Muskoka has been pretty relatively quiet in the case count for November. Do you feel it's a sign that maybe the curve is flattening here, or is it maybe just due to more of a backlog of testing?
It wouldn't be due to a backlog of testing. You've still got a low positive predictive value. That's an indication of the adequacy of testing relative to the number of positive cases that are occurring. It's true that Muskoka's test rate is quite a bit less than Simcoe County's on a per capita basis. Both have dropped. The province's has dropped. There's been a lot of speculation as to why that would be. I would be more concerned if we ended up seeing an elevation in our percent positivity, but we're not seeing that.
And just as a follow-up, obviously, as mentioned before, the gap is quite wide between Muskoka and Simcoe. And with the low case numbers, how do you feel maybe residents in Muskoka can sort of stay the course?
Well, testing is certainly one thing, and I strongly urge anybody who has symptoms or has been a contact of a case to be tested and to self-isolate. But other than that, it really comes down to the primary prevention methods, the sticking to your household, or if you live alone, an adopted household for close contact, and otherwise physically distancing from other people 2 meters, use of face coverings in indoor public settings and work settings, or if outdoors you cannot physically distance, and hand hygiene. So, to me, all of those things are going to be critical no matter where you live, whether it's Muskoka or Simcoe or elsewhere.
Perfect, thanks.
You're welcome.
Thank you. Mark Claremont from Muskoka. Go ahead, please.
Oh, hi. Thanks very much, Doc. Could you just elaborate on that one Muskoka case that you've got in Muskoka, Algonquin? Is it a male, female? Which hospital? And do you know whether it's a resident or a staff person?
So I'm very cautious about individuals and the identity of individuals. Usually decline to give too much detail that might allow for them to be identified.
So, I mean, you can't just even say whether it's male, female. Those are stats that are normally on your...
The other thing is that I actually don't know. I haven't looked into that detail myself.
Okay. In a somewhat related thing, on the dashboard of the Simcoe Muskoka dashboard, under the number 3 category, health system capacity, I think you alluded to this just a little bit earlier today. So I'm interested in the ICU ventilator bed occupancy rate in the center. Today it's reported at 34.6%, the goal 60%. How many ventilators are there in Simcoe, Muskoka, and what does 34.6 refer to? I can't figure it out, the gray bar versus the green bar.
It's an indicator. The percentage indicates how much space has been occupied. So of all of the ventilators, 34.6% of them are presently in use or in use when we obtain that data. The reason why it's green is because that meets our threshold of what would be good of less than 60%. So hopefully.
How many ventilators do you have in the Simcoe Muskoka reporting area?
I don't have that data. I'll get that for you and we'll let you know.
It'd be great if you could
Yeah.
answer later. Okay, thanks very much.
You're welcome.
Okay, thanks, Mark. Mike Arcelides from CTV, go ahead, please.
Greetings, Doctor. How are you today?
I'm okay. How are you?
Hanging in there. Well, here's my question. How many do you believe in our area have COVID-19 right now? We estimated at the beginning of this pandemic it was around 10 times. What do you believe those figures to be now?
I haven't seen a percent positivity result in recent months. So in the spring, at the height of the first wave, it was about 1% or 1.5% of the population that was positive by seroprevalence. The percent of the population found through a study to have antibodies in their blood. So I don't have the results of a more recent study to help inform that. I do believe we're doing a lot more testing now than we were in the spring, and that's reflected in the percent positivity result. The percentage of tests that we do that turn out to be positive now here is, I think, 1.3%, and in the spring it was in the range of 10%. So that means we're picking up a higher proportion of the cases that are out there. So it's going to be better than what it was in the spring, probably substantially better, but I don't have an accurate estimate for you.